So, if you're here watching this video, you fall into one of two categories. Either you've already tried everything to get rid of that rib pain that just won't leave you alone, or you're a patient who's just starting treatment but is already worried that you might eventually need a more aggressive procedure to relieve this pain caused by the intercostal nerve. Regardless of which one you are, I'm going to talk a little about the possible procedures that can be done in cases where conservative treatment, which you may have seen in other videos here on the channel, hasn't worked. Just to clarify, conservative treatment involves the use of medication, myofascial release in the nerve region, physical therapy, and sometimes even an anesthetic block of the intercostal nerve to help relieve your symptoms. If all of this has been done and you still have pain that won't let you be at peace, then surgery is indicated. When we talk about surgery, there are a few possible procedures. The first of these is decompression of the intercostal nerve. Decompression is performed through a small incision in the chest area where the nerve is compressed. We go to that nerve and remove whatever is pressing on it in that region. This procedure is performed under general anesthesia and takes about an hour. Normally, it's a quick and safe procedure, there isn't much bleeding, and the patient can usually be discharged from the hospital on the same day. If this procedure does not have the desired effect, there is the option of neurectomy, where we cut the intercostal nerve. This procedure is also performed under general anesthesia, is very quick, and the patient is discharged on the same day. This is possible because we have several intercostal nerves, and one of them, which causes pain, can be safely cut without affecting your breathing. The main issue, and what intrigues us the most and makes us anxious after the surgery, is whether the pain will improve or not. Because understand this, if the medication didn't work, if the nerve block didn't work, and surgery is going to be performed, the surgery is not 100% effective. If any specialist doctor says that surgery will definitely solve the problem, they're lying. Of course, there is a very good chance it will work, but it's not as simple as just having surgery and everything is fixed. Therefore, if you have pain that doesn't respond to medication or physical therapy and you're suffering from intercostal neuralgia, consider having surgery. Especially because surgical treatment, when performed within less than a year, particularly in patients with very intense pain, shows better results. Do you understand that performing surgery on a patient who has had pain for 10 years versus a patient who has had pain for 10 months can lead to very different outcomes? A patient who has had pain for a shorter period of time has a better chance of getting rid of that bothersome symptom. Therefore, if you suffer from intercostal neuralgia and it is not responding to conservative treatment, seek out a peripheral nerve specialist as soon as possible. If you enjoyed this content and noticed that there is very little information about intercostal neuralgia on the internet, help me out by liking this video and following our channel so I can produce more content like this.